Good afternoon, everyone. Welcome. Thank you all for coming. I would like to introduce Mayor Jon Mitchell, City of New Bedford.
Thank you, everybody. So maybe we should just grab the door quickly so everybody can listen up. So we're here today with Southcoast Hospitals for and the American Cancer Society for a very important event, a very important public health announcement that will pay off not in the days ahead or the weeks ahead, but pay off in the generations ahead. And what it involves is the following. I'm going to make sure if I don't get the name of the study correct. My good friend Liz Blanchard, an oncologist extraordinaire at Southcoast Hospitals Group, will correct me, and you'll hear from Liz in a second. But there is the American Cancer Society nationwide is doing what has been referred to as a CPS-3 study. Now, what does that mean? I think CPS is cancer prevention study, so it's kind of intuitive. But here's the deal. So we have, as a society, been able to make enormous advances in public health and in the treatment of once undefeatable diseases like many cancers because of the money that has been put into research and the research itself. In other words, because we have been able over the years to benefit from data collected from everyday citizens volunteering their time, volunteering their blood in many cases for the benefit of medical research. We've been able to crack the code on many cancers as well as heart disease and other diseases that we thought we could never get our arms around. One of the biggest examples is the Framingham Women's Study, which goes back to the 1950s, in which a number of nurses, right? It was a nurse-based study that revolutionized the way we treat heart disease. Nurses volunteered themselves to be studied, not in intrusive ways, but in volunteered data, volunteered blood samples, and so forth over a long period of time. And so researchers were able to study the effects of dietary habits and lifestyles on the heart and on the circulation system. And as a result, we have a far deeper understanding of the risks of heart disease and have been able to develop treatments along the way. And what does that mean? It means that people get to live longer, and that's the bottom line. It's because many people have been willing to step up. The American Cancer Society, with the assistance of many hospital groups, including right here in the Southcoast, with the Southcoast Hospitals Group, as well as with the help of the federal government, is launching another one of these so-called large cohort studies in which volunteers from across the nation, here and everywhere else, will come in and have blood drawn, and will offer demographic information about themselves and allow themselves to be studied, again, not intrusively, over time, so that researchers can have a good sense of how the world around us affects our risk to certain cancers. I mean, all of us know folks who have died of cancer. Roughly, I think it's what Liz, one out of every 7 women will get breast cancer, for instance, over the course of their lives. Other cancers, incidence of other cancers are even higher. Prostate cancer in men is even higher than that. What we need, and many of us have lost people as a result of cancer, friends or family members. This is our opportunity to step up and to provide the medical community, the scientific community, with the tools they need to help save lives down the line. And this is, we as Americans today owe really an obligation to future generations to do right by them in the ways that others have done in the past for us. So you'll hear in detail from Liz, as well as others who are going to come up here today, about how this will all work. But my job really today is to thank the Southcoast Hospitals Group for all of their hard work. And if you haven't checked out Southcoast Hospitals Group recently, you should. It's not just St. Luke's anymore. It's not just the emergency room that we're all familiar with. As good as that is, it has become a major medical institution in this region that does its own research, that is part of these larger cohort studies, and is really doing some groundbreaking work. So it's really a source of pride for the community, but also the source of great medical treatment. They're going to be part of this study. And as I said, I will call Liz up in a moment. I'm looking down at my cheat sheet. In fact, Liz is next on the list. But I wanted to thank also the American Cancer Society for filling the important role of coordinating and funding the study. Janet and Anna, whom you both hear from, have been spearheading this locally. American Cancer Society, as well as other organizations, have enabled cancer researchers around the globe to find some real breakthrough treatments, and have enabled people to live longer, more fulfilling lives as a result. And so we're here, and I just call upon all of us here in the New Bedford area to do our part, to volunteer our time, to go ahead and go to Southcoast and have some blood drawn, provide some information. It doesn't take a long time. It doesn't hurt. Needles these days are so sharp that they won't make you cry anymore. So think about that. Consider that as a way of paying forward a debt to future generations. And I just want to thank all of you for supporting these efforts today. And now let me call Liz Blanchard up. Liz is the medical oncologist and director of the clinical trials program at Southcoast Centers for Cancer Care, which is housed in Fairhaven. Southcoast Hospital Group is obviously based here in New Bedford, and Liz is an extraordinarily accomplished clinician and researcher, and we're lucky to have her in the community. She's a New Bedford resident, and she's fully immersed in this community, but she's also doing great work on a global scale. So Liz, would you come on up and tell us all about the study? Thanks.
Thanks very much. So I'm Dr. Elizabeth Blanchard. As the mayor mentioned, I'm the director of clinical trials at the Southcoast Centers for Cancer Care. And I'm very happy to be able to come today and to talk about what I think is going to be a very exciting study. As the mayor mentioned, cancer is a devastating illness. And we all know people whose lives have been touched by cancer. Countless numbers of husbands, wives, parents, sons, daughters, brothers, sisters, friends, patients. And while the field of cancer care and cancer research is moving forward at an incredibly rapid pace, and we're now making great strides to improve the way that we treat cancer, it still remains a major problem. So more than 6 million people die worldwide every year of cancer. In the time that it takes us to do this press conference, there'll be 1,000 people that will die of cancer worldwide, just by the time that we're done here. And the number one and best way to ensure that someone you love doesn't die of cancer is to prevent them from getting it in the first place. And what we hear a lot of news and information about what might cause cancer, what might not cause cancer, what might prevent cancer. What we really need is hard scientific evidence and scientific data to really answer those questions. And this is what makes this effort by the American Cancer Society incredibly important. So what we're asking the Southcoast residents to do is to enroll in this, what will be a historic study, what is a historic study, called the Cancer Prevention Study-3, or CPS-3. And what we're asking is that local men and women between the ages of 30 and 65 from every background with no personal history of cancer who are willing to make a commitment to the study to come and enroll and be a part of the study. This is the only study looking at lifestyle factors of all cancers that is currently enrolling in the United States. So this was really a unique effort, and there are more than 100,000 people that have already enrolled. So involvement in this study, or the CPS-3 study, will help the cancer researchers from the American Cancer Society and other places understand what the genetic background of cancer is, what environmental factors may play a role, what lifestyle factors may cause or prevent cancer, and this will ultimately save lives with this kind of information and knowledge. Now, what the cancer researchers will do is take information to build on what has been already discovered in the past. So previously, we know that cigarette smoking is one of the major influences in the development of certain cancers, including lung cancer and bladder cancer, among others. We know that cigarette smoking leads to premature death from a number of things. We know that larger waist size and people who are sedentary are at higher risk for certain cancers. Obesity is a risk factor for dying of cancer. Physical activity is important, and that air pollution and things have also influenced the development of cancer. Now, what we need to do with this study is to solidify that knowledge, get more details about that knowledge, and figure out what other factors are at play here. There are a number of enrollments and a number of opportunities to participate in the study. They're going to take place in the Southcoast area the first week in June at the Southcoast Centers for Cancer Care at Charlton Memorial Hospital in Fall River, St. Luke's Hospital in New Bedford, Toby Hospital in Wareham, and with the support of the City of New Bedford at Fort Tabor in the community center there in New Bedford. What does it take to be a participant? So initially it'll take 20 to 30 minutes of your time. The staffers and the researchers will take a measurement of your waist, take a small blood sample, and ask some questions about your lifestyle and your behavior and some of your health history. After that, surveys will be mailed out every 2 years, and you'll be asked to fill out those surveys with similar kinds of questions, and you'll get annual updates as to what the study has found and what kind of research is going to come out of this type of study. So it's a long-term commitment, but the commitment is minimal and very important. It's important that folks who are thinking about participating know that all of their information will be kept private. It costs nothing to participate, and it's a very worthwhile enterprise to join. So please consider joining. If you know anybody who has been touched by cancer, this is an easy and very important way to honor their struggle and to help the American Cancer Society progress against their fight against cancer.
One quick question, Liz, one practical question, and that is, so is there a website that people should go to in order to find out those times and places where they can be screened?
Sure, and we have, I think, some information. We can hand out some information, right, on to where the locations will be and what hours they'll be. It's the first week in June. They'll have certain days at Charlton, certain days at St. Luke's, but we have all that information.
For a television viewing audience, it should go to the Southcoast Hospital website?
Where will it be, Stephanie, you think?
It's also going to be at www.cancer.org/CPS3NE.
You got that?
www.cancer.org/CPS3NE.
Good. All right. So we'll repeat that one more time. All right. So let me bring up Anna Costa from the American Cancer Society, who is a volunteer. Anna, come on up. Thank you.
Thank you. My name is Anna, and I'm a relayer. 13 years ago, I went to the Relay for Life at Voc, and I went because a friend of mine had a team in honor of his sister, and he was singing in the closing ceremonies. And I had donated, and they said, come and see what it's all about. I knew they wanted me to do some serious work. I was not too serious about joining, so I went for the closing ceremonies. What can they get you for, right? You're closing. That was 13 years ago, and I'm still here. Relay gets you by the heart. It takes those people that we have with us that have cancer, the survivors, and it celebrates with them at 6 o'clock. They take the track. We cheer them on, and you never forget that. At 9 o'clock, we do luminarias. We cry with those people who have lost ones, and we never forget them. We light their bags. They're with us still. And 3 years later comes May 22, 2002, and I heard the words, "You have cancer," for the first time. I was a relayer. I knew where to turn, and I chose to go to Southcoast Hospitals, have my surgery here, close to home, and I missed Relay that year because I was still in the hospital. It couldn't have worked out better. I haven't missed relay since. 2 to 3 of us diagnosed with cancer will survive. We're still working on that 3 to 3 ratio, and that's why I relay. I can no longer take part in the CPS 3. But what I can do is call all those lovely people who said, "What can I do for you?" And now's the time. "Hi, this is Anna. I need you to take a walk, to give 7 little tablespoons of blood, to put a little tape measure around your waist and help prevent cancer." 1.5 million people will be diagnosed this year. You will probably know a few of them. For their sake, for your sons and for your daughters, come out and join us. Make that first week of June the day you take a step to helping prevent cancer. Then come to Relay and help us support those who already have it. Thank you.
I don't know how you could say no to that. That was great. So do we know, by the way, just so again, for our television audience, do we know the date yet of the Relay for Life?
The relay flight was June 7th and 8th.
June 7th and 8th at Walsh Field, the high school. Starts in the early evening, so
6 p.m.
6 p.m. to be precise. Thank you, Anna. Thank you, Anna. It's a great event, and everybody should go. You know, I think if you live in the west end of New Bedford, you will know what's going on anyway, because the noise that comes out of the stadium that night resonates far and wide, and so it's a terrific event for a terrific cause. I invite everybody to go up. So now I think that's it. Janet, do you have anything else to add? Oh, yeah. Oh, I'm sorry, go ahead.
Well, that's okay. We just want to thank Mr. Mayor, as well as the Health Department, Dr. Weiss, Dr. Blanchard from Southcoast Health Systems, the YMCA of South Coast that are going to help us recruit, and Anna, for your wonderful words. I couldn't have said it any better. We really appreciate the support that the city of New Bedford has given us in this effort, and we know that we're going to be successful, and we know because of all of your efforts and the efforts of others across the country, there'll be future generations will never hear the words, "You have cancer." Thank you.
One more time, the website, again, just bears repeating. All right, so it's right. So here it is. So you can register at www.cancer.org/CPS3NE, or you can call a toll-free number at 888-604-5888. And again, I just wanted to thank everybody here at American Cancer Society, Southcoast Hospitals Group, Brenda Weiss, the health director of the city of New Bedford, who's doing a terrific job. Everybody, this is a great effort, and let's get some people signed up. Thank you very much.
Thank you for calling your GED Pep Talk Center. All right, now, are you ready for your GED Pep Talk?
Being nervous is okay. It just shows that you're serious about getting your diploma.
A lot of things are scary. Heck, I'm scared of clowns.
No quiero ir. Danny, no lo puedo hacer.
DMC, life in your pep talk style.
Just keeping it real, Debs, just keeping it real.
Whatever motivation you need, we've got a pep talk for you.
Get your GED pep talk and find free classes at yourged.org.